Imagine walking into a hospital expecting a normal delivery. But within minutes, you are told that an emergency Caesarean section or C-section is the only safe option. Would you question the doctor? Or would you trust them completely? Today more than 1 out of every 4 babies born in India is delivered through a C-section. In private hospitals, that number is even more shocking. More than half of all births are surgical. Are these operations saving lives? Or has childbirth become a business? Let's uncover the facts. Introduction. Hello everyone. Welcome to the channel. If you enjoy deeply researched documentaries on healthcare, public policy and social issues, don't forget to subscribe. A C-section is one of the greatest medical advances ever made. It has saved millions of mothers and babies worldwide. But when performed without medical necessity, it can expose women to avoidable surgery, long recovery periods, financial burden and future pregnancy complications. India is now facing a serious question. Are too many C-sections being performed? Let's understand what the data says. India's C-section boom. According to the latest National Family Health Survey NFHS6, India's C-section rate has increased from 21.5% in 2019-21 to 27.2% in 2023-24. That means more than 1 in every 4 births now happens through surgery. But the real difference appears when we compare public and private hospitals. In government hospitals, around 17% of births are by C-section. This is close to what many public health experts consider an acceptable level because these hospitals mainly perform surgery when medically necessary. Private hospitals tell a very different story. There 54% of all deliveries happen through C-section. That means more than every second mother undergoes major surgery. This raises an important question. Why is the rate 3 times higher in private hospitals? When is a C-section necessary? Let's be clear. C-sections save lives. Doctors recommend them when normal delivery becomes dangerous. Examples include baby in breech position, placenta blocking the birth canal, baby showing signs of distress, labor not progressing, severe bleeding, high blood pressure during pregnancy, multiple babies, previous Cesarean deliveries, serious maternal illnesses like diabetes or hypertension. The World Health Organization recommends using something called the Robson classification, a scientific system that evaluates multiple pregnancy-related factors before deciding whether surgery is required. In these situations, C-sections can prevent deaths of both mother and baby. The problem begins when surgery is performed without genuine medical need. One mother's story. Let's hear a real-life story. A kindergarten teacher, whose identity has been changed for privacy, conceived her first child through IVF. Because IVF pregnancies are often considered high risk, doctors recommended a C-section. The surgery went well. She delivered a healthy baby girl. A year later she became pregnant again. She returned to the same hospital. Doctors informed her that she had developed high blood pressure and advised another C-section. She agreed. But during surgery, excessive bleeding began. Doctors couldn't stop it. Eventually they removed her uterus to save her life. Soon after, she developed jaundice. Her family could no longer afford private treatment and shifted her to a government hospital. Today, she lives with permanent physical and emotional consequences. The family's medical expenses crossed 6 lakh rupees, forcing them into debt. Her words are heartbreaking. We trusted the doctors. Today we are still paying the loans. Stories like these remind us why every surgery must truly be necessary. Why are C-sections increasing? Experts say not every increase is bad. Modern pregnancies are changing. Women are having children later. IVF treatments have increased. Obesity, diabetes, high blood pressure, all have become more common. Families today often have only 1 or 2 children. Parents naturally become more cautious. Doctors too are increasingly worried about lawsuits if complications arise during labor. As a result, many prefer surgery over waiting for a normal delivery. There is another medical reality. Once a woman has her first C-section, the chances of another C-section during future pregnancies increase significantly. This creates a cycle. Higher C-sections today mean even higher rates tomorrow. When surgery stops saving lives, one might assume that more surgeries automatically mean safer childbirth. But the evidence suggests otherwise. Take Telangana. It has India's highest C-section rate, over 62%. Yet its maternal mortality is not the country's lowest. Compare this with Kerala and Tamil Nadu. Their C-section rates are lower, but they report some of India's best maternal health outcomes. Similarly, Karnataka performs C-sections at rates similar to Tamil Nadu, yet maternal deaths are much higher. This tells us something important. Simply increasing surgeries does not automatically improve survival. Quality of healthcare matters much more. As public health experts explain, the goal should never be to maximize C-sections. The goal is to ensure surgery is available only when needed. Are private hospitals performing too many surgeries? This is where the debate becomes controversial. Several public health experts argue that many surgeries performed in private hospitals are medically unnecessary. Some estimate that around 3 out of every 5 C-sections in India's private sector may not be medically required. States show dramatic differences. In private hospitals, Jammu and Kashmir records nearly 90% C-sections, West Bengal nearly 88%, Telangana around 84%. Why? Experts suggest several reasons. One is fear. Women are often told that normal delivery may be risky. Families naturally choose the safer sounding option. Another reason is convenience. A normal delivery can take 12 hours, sometimes even longer. Doctors and nurses must continuously monitor the mother. A C-section can be scheduled, completed within an hour, predictable, efficient. From a hospital management perspective, surgery consumes less time. Some experts also believe financial incentives may influence decisions because surgical deliveries usually generate higher revenue than normal births. The cost of childbirth. The financial impact is enormous. Average childbirth in a private hospital costs more than 39,000 rupees. That's roughly 17 times more than public hospitals. In states like Telangana and Tamil Nadu, private maternity care is even more expensive. Many families borrow money, sell assets, or reduce spending on food and education. For them, childbirth becomes a financial crisis. Hidden health consequences. C-sections also affect newborn care. Research has shown that babies born through vaginal delivery are much more likely to begin breastfeeding within the first hour of life. Early breastfeeding is extremely important. The first milk, called colostrum, contains antibodies that protect newborns from infections. After surgery, mothers often struggle because of pain, anesthesia, and delayed recovery. Even a few hours delay in breastfeeding can increase health risks for newborns. What can be done? Experts recommend several reforms. First, every hospital should follow scientific guidelines like the Robson classification before deciding on surgery. Second, India needs more trained midwives and labor nurses to support normal deliveries. Third, payment systems should not reward hospitals for performing more surgeries. Fourth, pregnant women should receive complete counseling about both vaginal birth and C-sections. And finally, women should always have the right to seek a second medical opinion whenever surgery is recommended. And there is no immediate emergency. Conclusion. C-sections are one of medicine's greatest achievements. When medically necessary, they save lives. But unnecessary surgery benefits nobody. Not the mother, not the baby, not the family. The real challenge is balance. Every woman who genuinely needs a C-section should receive one immediately. Every woman who can safely deliver naturally should be given that opportunity. Childbirth should be guided by medical evidence, not fear, convenience, or financial incentives. Because every birth deserves dignity. Every mother deserves informed choice. And every child deserves the safest possible start in life. Thank you for watching.